there are some people, some people in positions of influence who are influencing so that past curfew there were some joints that were remaining open because the owners are known. The idea of a committee serving as an enforcement agency is to ensure that no such favoritism is seen in the counties for any activity. May it be the opening of pubs, may it be funerals, may it be entertainment areas. I think it should just be made clear that the emphasis on enforcement is going to be made stronger going forward. The committee, the task force, the healthcare task force here, led by the chair, Eva Jenga, has been tasked with ensuring that home-based isolation and home-based care for COVID-19 positive cases, the management is enhanced for the same. And the reason why this is very important is because moving forward, we are also, because of how stretched the facilities are in the main hospitals, we are going to really emphasize on home-based isolation and home-based care. Those who do not need oxygen, those who do not need ventilators, will have to be looked after at home. And this means that those of us who are operating freely must be very, very careful, because when you know that you have to be taken care of at home, where your children are, where your family is, then it behoves you to ensure that you stay safe. Because if you don't need oxygen, if you don't need ventilators, it is going to get to a time where you will have to be looked after at home if the trend that is there currently continues. This means also that as a ministry, we take the responsibility of ensuring that our healthcare workers have increased their ability to move, the mobility of the healthcare workers supervising isolation, people in isolation, including the provision of more ambulances, the provision of more personnel, so that they can be able to supervise and move around as quickly as possible. But I think the import of this is just to say that in our own homes, we should now prepare. We should now be prepared to host our family members who may be infected by this virus, provided they are not, they don't need hospitalization. For this reason, we are also urging our hospitals to quickly expand our ICU facilities and to the greatest extent possible, redeploy some of the resources we have so that we can be able to fight against COVID-19. Again, the task force has been asked to identify areas that can be converted, isolation facilities that we can quickly convert into ICU facilities. This is because if you look at the first two waves, the necessity, the need for ICU facilities did not rise up as high as this third wave is exhibiting, and therefore we need to prepare more ICU facilities in the country, and we need to do so at each county, because moving forward, just like was happening round about the second wave, moving forward it is very likely that counties will have to take care of their own patients at the county level, because Nairobi County has got a large population and is already beginning to feel the stress of having more patients than most of the hospitals are able to. This is at a time when a lot of county ICUs are still empty.